Dr. Ulrich Friedrichson. I think he gets mentioned during his lecture, when others are lecturing. It's a pleasure to have him continue his talk on cell therapy today and tomorrow.
In addition to the lecture this morning, I want to talk about cell therapy today and tomorrow. To talk about one of the most promising therapy methods in medicine and their importance in the present and in the future. We have to go back to the biological future. The evolutionary biology is a scientific approach to see and realize nature's continuing revolution, which began in the past from the beginning of life, accepts the today as an intermediate stage and sees the future not as a vision but as a reality. The whole medicine is an experience following the principle of trial, error, and hopefully success, and is based on empiricism. All parts of the medical field have the same basis. The modern cell therapy, as we propose it, is based on scientific research, as we heard from Dr. Mohammed this morning, from the mid of the last century, and shows good and highly promising results. The whole stem cell research and discussion about is looking and heading therapeutical in the same direction. It was long discussed if the effect of such a therapy, of such a treatment, is unspecific or specific. Since the development of modern medicine goes more and more in the direction of subspecification, we lose actually our sight for the whole body, for the human being as a whole. This leads us actually away from the original thought of restitution, regeneration, recovery, and in the best case, healing. We are going in normal medicine towards repair of single parts, just like a mechanic. The cell therapy today can be understood as a complex therapy for different, mostly degenerative diseases with cells, cell parts, growth factors, cell organelles from embryonal or early fetal, seldom late fetal tissue. Through specific application from different labs, more refinement in the production and the selection of special cells and cell parts using cell material of differing evolutionary cell age, we have here a potentiating effect in the regenerative possibilities in the cell therapy. Prospects in treating different diseases and the general application of the new cell therapy will be shown further on in this lecture. As we found and stated in our scientific research decades ago, the genetic variability, as I said already this morning, is only permitted in the evolutionary process where life and survival of species is not endangered. In the embryonic phase, we find genes active, which we share with almost all, we can say all mammals. We go from a 2-cell stage, 4-cell stage, 8-cell stage to a cell mass of the so-called inner layer, inner cell mass. We collect those cells and divide it, and from undifferentiated cells we go to specific cell lines, which go further on to heart cells, neurons, bone marrow cells, skin cells. Undifferentiated embryonic stem cells, they don't know what they're going to be, and especially they don't know to whom they belong. Stem cells are types. We have embryonal, as we saw already in the lectures before, neuronal, mesenchymal, and what kind of tissue you can derive from. The clinical therapy has an immense potential in treating injured organs, help to repair degenerative tissues and organs, humans as a whole biological system. And that's always what I want to stress. As a consequence of these findings, those therapies are not only able to heal, but really to regenerate. And there were a few questions how long we follow up, or we can follow up patients. In our office, in our research location, we followed up some patients more than 30 years after application. And so we can also see how they improve and how they stayed improved. We have in this phase of embryonal or early fetal cells a huge mass of biological activity, biological potency to repair defects in the biosystem Homo sapiens. Whether they are genetically determined, like in Down syndrome or in Grady-Schadt syndrome, just to mention a few, or acquired during life. Therefore, we are able to repair and activate through embryonal cells and the malfunction, low function in our body. But this is not, that is only the so-called start-up, not a targeted therapy. The cell therapy has to be understood as a dynamic, self-developing therapy in the direction which uses experiences of the past. It uses modification and enhancements of the present to be the therapy of the future, what we would say the gold standard of therapeutic medicine. We want to prevent early aging. We have to go back to what we normally say school medicine. As an example here, we may look at hypertension. In the past centuries, the physicians treated the hypertension, for example, with bloodletting. Today, medicine is using diuretics, beta blocker, with or combinations and other substances which addresses single aspects of the disease. We want to stress the word single aspects. As you know, the development of hypertension is multifactorial. That shows that with a conventional medicine, we work symptomatic, not treating the cause. The cell therapy, as we understand it, is constantly refined, but as always, we need a diagnosis to get to a causal treatment. Here, we have to comprise the biological biography of the individual and consider his, her, or him in his wholeness, all their weak points, inborn genetic errors, inflammations, autoimmune processes, toxic or environmental damages. As we prevent early aging, we have to look what causes early aging. Viral, bacterial, parasitic infections, traumas, heavy metal, very important in neurological diseases, carbohydrate rich nutrition, stress, psychostress, as we heard. Also medications, which we normally get masses of, antibiotics, statins, beta blockers, nitrates, whatsoever. We stated in our early lecture that xenograft transplantations are rapidly transported to the damaged or diseased organs and organ systems of the host, and by means of the mechanism of the cell crosstalk. They are promoted to activate the existing cells. We use here cell suspensions, cell parts, and growth factors of already highly specialized early fetal organ cells. We have here a far more targeted therapy, which nevertheless addresses the biosystem as a whole and support in this way repair mechanisms and starts regenerating activities, so for heals in a causal way. We support with anti-inflammatory components from early fetal cells the treatment of chronic diseases and also autoimmune diseases in an excellent and especially biological way. As an additional agent, we use in the modern cell therapy mesenchymal cells, cell organelles or cell parts, since we find in this kind of tissue extremely high levels of most active repair genes. The modern stem cell therapy, and scientists use more often mesenchymal stem cells for research and therapy, since they have a special potency in regeneration and repair. In special cases, we use for anti-inflammation and regeneration extracts or cell suspensions from the different or both sides of the placenta. The placenta, an organ in itself, is carrier and production site of a multitude of growth factors, repair proteins, and important enzyme systems. During pregnancy, this organ supplies the growing organism with a whole variety of biological agents to protect it against deleterious toxic substances. In addition, it protects the mother organism against potential damaging products from the baby. In general, we have to state that nature always protects the mother. Why? Because a female is henceforth more important for reproduction and preservation of the species than a single offspring. We show a few examples of cell therapy from our clinical research experience from the last 35 years. Here again, we use, as we said, we use cells, stem cells, isolated on your left side, and on the right side you see the stem cells which we added so-called growth factors. We call that priming. Here again, stem cell isolates, fresh, and then we added growth factors after 7 days, and with and without serum. So serum doesn't make any difference, but we see the growth factors which we add from different cell sources. They activate the cell growth and is so forth a boost, and it's a booster for regeneration of the not only the cells we give, but also of the existing biosystem which we, or the patient we want to treat. And this is a nice proof for what we that we use the direction. We use research experiences from newer time and combine that with the experience doctors had in the last century, or even before that. Now the examples. We showed here, we looked at 793 patients who got heavy liver diseases through hepatitis B and C. And we could see that we have on an average downscaling of the liver enzymes from the start point 100% to 22% of the originally high levels of GOT or GPT. So that makes a lot cutting down. We have also data on a virus load in hepatitis C in the different genotypes, which show also with the cell therapy that we could cut down on the numbers from 1, 2, 3 million to non-detectable. The cell therapy of heart insufficiency, like you heard Dr. Kugler, we have a lot of experience. We put the NIHA classes 1, 2, 3, 4, and we show here class 1, we had 375 patients, in NIHA class 2, 231 patients, 153 patients, and in NIHA class 4, which are bed-driven patients, 72 patients. And before and after cell therapy. And you could see that we can step down on the number of the NIHA class from NIHA class 1 to 0, from 2 to 1, from 3 to 2, and from 4 to 3, or even below that, in quite a certain amount of patients. We could see in NIHA class 1, we had a percentage of a downgrading percentage for more than 50, actually 56%. In NIHA class 2, we had from 52%. In NIHA class 3, we have 50%, and even in NIHA class 4, we still have more than half. That was 51%. So this is quite impressive numbers, which and those patients had at that time in the beginning no altering of their pre-existing medications, and when we stopped the finding, when we reviewed that, they had none medication left. The other problem diseases, chronic diseases, are the chronic inflammations, the colitis ulcerosa, and we took there 76 patients, and we measured, as we normally do, the CRP, the C-reactive protein, as a measurement of inflammation. And we had, on an average, a measurement from 68 milligram per deciliter. The cutoff normally is 5. And after treatment, we had, after 16 weeks, we had all of those people at 5 milligrams per deciliter at the normal stage or below. Also highly significant. The morbus Crohn, the Crohn's disease, also, especially in young patients, a real big problem. We saw that they were affected with bloody stools, and we had on 59 patients on an average of 15 bloody stools a day. And when we looked after those, and they at the beginning they had high dosages, different but high dosages on cortisone and other anti-inflammatory medications. And when we looked at after 3 months, we found that none of them had any cortisone left, and they had at the most 0 to 1 stool, loose stool, no bloody stool left. Now, one of the most important neurological diseases is the Parkinson disease. And it's in Germany alone, we have at least 400 to 450,000 patients, with a rapidly growing number. Here we look at the akinase after cell therapy, and we had 208 Parkinson patients. It's a big number over those many years, and when we started out, we made it 100%, and stepped down. And after 12 months, we looked at those patients again, and they had a reduction of 63%. There only 37% akinase left. The reduction of the tremor, which is most of the time bothering the patients most, we had the same amount of we had the same patients, and they were stepping down to 18% of the beginning before they had cell therapy, and the medication they had before and after the reduction of the tremor, they had between 10% and none medication left. Another extremely important neurological disease is, as we heard already today, the Alzheimer's disease. In Germany, we have 1.2 million patients. In other developed countries, we have even bigger numbers. In the United States alone, there are 5.4 million Alzheimer's patients who are treated. We looked at the cognitive function and the improvement through cell therapy. And here we used the different kinds of Alzheimer's severeness. The improvement of mild cognitive impairment. We showed we had 127 patients, 34 females and 84 males, ranging between 53 and 75 years. And as you know, there is no real medication, school medicine, which helps or even stabilizes the progress of the Alzheimer's disease. Here we have an improvement from the mild cognitive impairment by 82% after review after 12 months. We have here either a stable disease or even getting better. In the state of severe conditions, we saw and see between 59 and 71% improvement or stable disease. And that's again on the question the lady up front had about the follow-up. We follow up those patients not only a few weeks, but we have a recall system where we either the patients come by themselves or we have questionnaires which we try to get in touch with them. Those patients were controlled for more than 5 years, and we see that the progress and the progress that we had a stable disease for many years, and in some cases we do cell therapy again to stabilize, and the most people, they experience getting better, as you heard before, and some of them, well, I'm so much better, I want to keep as long as possible this kind of well-being. And so the recall, when the people come back and ask for another treatment or for more treatment, is not because they are getting worse, but they want to be stable and as good as they were after the first month of the first cell therapy. In multiple sclerosis, we see also very good results, which we have not released yet. We're at the process of getting that together for another lecture. As we stated before, we give and can give the years more life, and in countless numbers more years to life. And as you saw in the last slides, it's worthwhile to treat those so far not treatable diseases with cell therapy. So please keep in mind, there are multiple possibilities for cell damaging, but it's never too late for a change and start with cell therapy. Thank you.
Please contact the German Society for Thymus Therapy for further information.